innovazione per ridisegnare e disegnare i nuovi orizzonti del sapere, della scienza e della medicina. E dunque diamo il via subito a questa 2 giorni con i saluti istituzionali, a cominciare dal padrone di casa, il magnifico rettore dell'Università Magna Grecia di Catanzaro, professore Giovanni Duda.
Questo workshop, che è arrivato alla 3ª edizione, coglie perfettamente uno fra gli obiettivi fondativi di questa università, cioè quello della inter e della transdisciplinarietà. Il fondatore dell'Università Magna Grecia di Catanzaro, il professore Salvatore De Luca, parlava di diversi saperi che si integrano, saperi che contaminano l'uno l'altro, e da questo nasce una nuova linfa che nutre l'innovazione e che nutre
un credito formativo come materia scelta, proprio perché riteniamo che questo sia un importante momento di crescita, in cui non solo i nostri ragazzi del corso di studio di medicina, ma ancora di più tutti coloro che sono
practice seen as the domain of immediate action, biotechnology viewed as a promise for the future, and medical humanities considered a reflection on the meaning of care. Yet the reality of vascular disease, arterial, venous, lymphatic, knows no range boundaries. Vascular pathology is biomedical but also social. It is technical but also relational.
In realtà, anche perché, come possiamo vedere da questa flowchart, in realtà il sospetto viene da sintomi, spesso sintomi intermittenti come lo zoppicamento o anche delle ferite che non si rimarginano, e quindi c'è una sottovalutazione anche in termini tempistici assolutamente importante, ma ciò che conta, vedremo, è anche l'assoluta presenza di situazioni estremamente asintomatiche. Quindi da un lato la patofisiologia, che è una patofisiologia direi quasi che permette di arrivare al nostro obiettivo, quello di evitare la malattia. E in quest'ottica sappiamo che gli interventi convenzionali di prevenzione primaria sembrano non essere completamente efficaci, e pertanto alcune nuove strategie, come per esempio l'utilizzo di strumenti di intelligenza artificiale quali chatbots, gli strumenti come delle, mobile, oppure praticamente gli strumenti che hanno strategie di intervento, e sono dei fattori legati al paziente, come ad esempio le conoscenze sul trattamento, alla terapia come la complessità, alla patologia come la gravità, o socio-economici come il reddito, e ancora del sistema sanitario come il mancato collasso.
Now, as you heard, he is based at the University of Maryland. Before, he served as emeritus at the University of Alabama, and where he was also the chair of the department of sociology. And today, he will speak about one of his main theoretical contributions, which is health lifestyle theory. And he will try to connect this topic with the problem of aging. Please,
especially in the field of medical sociology and sociological theory. His extensive research has significantly shaped the understanding of the social determinants of health. He is particularly known for developing the health lifestyle theory and for influential work on health disparities, mental illness, and social stratification, global public health. His international standing in the discipline also includes services as president of the Research Committee on Health Sociology of the International Sociological Association from 2006 to 2010. Additionally, he has contributed.
It's interesting to see how the lifestyle patterns align in both countries by social class. That is, there was the working class health lifestyle are very similar in both countries, the same in upper class, upper middle class, and so forth and so on. So it's clear that something else was going on. In other words, health lifestyles are not just a matter of choice for one themselves.
In larger epidemiological studies, usually social structure is depicted by education, occupational position, and income. Bill has already mentioned that. And if you are going to the social structure in detail, we say, what is education? So education is synonymous for knowledge, for finding solutions, for having flexibility, and ways.
Several social determinants of health have been shown to be related to cardiovascular mortality. Some of the best known and most studied include socioeconomic status, income level, education, access to healthcare services. But in recent years,
Professor Dodo, the dean of our file, was supposed to be here next to me. Unfortunately, she's unable to attend. She asked me to convey her greeting to you, and I hope her absence will not feel too much. It's a true pleasure.
Of the university where I work, this is a shared humanization and all work aim is to integrate and promote all activities related to humanizing care. So I invite you to share your ideas or project because we need to spread a culture of humanization. And to move toward conclusion, the quality of care must not depend on the local places. It's important geographic and social demographic inequalities in access to treatment.
It is in this space of vulnerability that medical humanities become fundamental. They remind us that care is not only about blocked artery, ischemic lesion or surgery, but also about the whole human being. Medical humanities are a bridge between what biomedical model observes and what.
In PhD, in to access to care, effect diagnosis and treatment. We must combine biologic and social life to improve nursing assessments. Biomarkers show what's happening inside the body and they show inflammation, vessel damage and liver risk. Social markers show a person's quality of life. They include stress, income, education and hosting. These factors affect diet, blood pressure and treatment.
Conditions like peripheral heart disease or venous insufficiency requiring ongoing management for pre-circulation, mold healing and complication preventions.
That he had, and now he is well recognized as one of the mentors of the vascular surgery. Then we had several achievements that we had during the last century with Röntgen that discovered the X-rays, who now is part of our job every day, and the guy who for the first time developed the arthrography and the angiogram. This was Portuguese.
Represents a more flexible alternative to expand anatomic applicability and facilitates vertical especially for complex anatomy. Also, thanks to its dual configuration duration allows the treatment of arterial aneurysm and
10% of the increase plus the renal level, while the postoperative side is the length over which all of the endocarditis is opposed to the outflow. Thing is, what are we getting after the EVA? And it doesn't matter, that's the change.
What kind of stents is available, what kind of neck do we have, and is it suitable to do it endovascularly? Because to be honest, also in my clinic, the first way to go when I see a ruptured aneurysm is, can I treat it endovascularly? And then if that's not the case, then I call the colleagues and try to do it locally. That's the situation where we are nowadays. But it's not always, as I mentioned, it's not always possible.
Year, and the third leading cause of death and disability combined. And also, unfortunately, this number has substantially risen in the last 30 years. The incidence in particular has risen by 70%, the deaths by 44%, and the deaths by 32%. So in 2021, there were about 12 million incident stroke and almost 94 million prevalent stroke.
Artery that serve the inner ear are terminal type without collateral support, and vertigo is the most frequent and early symptoms, sometimes the only one of vertebrovascular infarct. And in vertebrovascular infarct, about 60% of patients have a history of at least one vertigo isolated episode, and about 20%
tools and no significant difference in outcomes between general and local regional anesthesia was found, but general anesthesia is associated in this RCT trial with the higher risk of perioperative stroke, infarction or death. Moreover, a lot of surgeons refuse to use local regional anesthesia, it's difficult to manage, and
let us examine our first case, a 55-year-old female presenting with massive neck swelling minutes after returning to the ward post-steroidectomy. Let's look at the imaging. The CTA immediately reveals a massive postoperative hematoma in the left thyroid bed, deviating the trachea to the right. The scan highlights multifocal vascular injuries. We identified active bleeding sources in the territories of both the
not translated in English till now, it's just in Italian and Polish language. And this is really a very interesting game. And today we have the opportunity to see together exactly this game in the field, for example, chronic venous disorders.
For humans, and have provided the basis for the scientific development of modern drug therapy.
First of all, I would like to invite you to our little museum of history and curiosity of medicine, with more than 3,000 ancient medical instruments, engraving and old books. The first in the world with a single room dedicated to the lymphatic system and lymphology. This is the first original book of Gaspar Azelli in my collection.
the first speaker, Michelangelo Sartori, speaking about VDA prophylaxis from hospital to home. A long way.
Dr. Michelangelo Sartori is a physician specialized in angiology and coagulation disorders at the IRCCS, Azienda Ospedaliera Universitaria di Bologna, Policlinico Sant'Orsola Malpighi, where he currently serves as senior medical officer. Since the late 90s, he has
like pneumoperitoneum or antitandem positions that are associated with all risk factors. So we have one first certainty in this kind of topic, because if you look at the Caprini score and at all the revisions that already has been published in literature, we see that already 3 items of this score that are all related to complex abdominal surgery and oncologic surgery are already
2012, the same guidelines by the ACCP on antithrombotic therapy downgraded the strong recommendation to 1B. And after several years, in 2018, the American Society of Hematology guidelines downgraded once more the recommendation, and as you can see,
coloro i quali hanno la possibilità di far partire delle indagini penali, dei contenziosi amministrativi e procedimenti, appunto, come dicevo prima, civili per il cosiddetto risarcimento del danno. Il medico, per la normativa naturalmente nazionale, ha obblighi, perché è stato normato anche questa naturalmente nuova fattispecie, di referto e segnalazioni in caso.
And societal expectation, and all these may shape risks and outcomes in vascular disease. Unfortunately, much of our evidence base comes from male-dominant cohorts, which has resulted in systematic under-recognition and under-treatment of vascular disease in the females group.
Surgical options to align vocal characteristics with gender identity. And the desire to feminize the voice is deeply tied to societal acceptance and the ability to navigate daily interactions without stigma. Failing to achieve satisfactory feminization through conservative methods often leads
and to target serum levels of the sex steroids to match behaviors associated with the individual's gender identity. We therefore have 2 therapeutic strategies related to these goals: masculinizing therapy based on testosterone and feminizing therapy based on estrogens and anti-androgen treatments. In this review from our group, you can see a summary of the different hormone therapies used.
The development of transgender surgery centers, the codification of the World Professional Association for Transgender Health Standards of Care, and of course the insurance coverage by Medicare for some of these procedures. And gender-friendly surgery, the necessity of a well-documented persistent gender dysphoria before proceeding with intervention, the patient must be an age of consent, and all significant mental and medical issues.
Can study this population, and I have created a framework for health professional education in TGD health. In conclusion, as Lord reminds us, it is not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences. Thank you very much for your kind attention.
Thank you to Davide for your nice presentation.
E ora presentiamo uno dei partner di questo congresso che in questa giornata sarà parte attiva con una proposta culturale e scientifica di grande valore, Scienze Sociali in scena. Si tratta di un progetto di divulgazione scientifica in chiave teatrale, ideato da Davide Costa, assegnista di ricerca presso l'UMG, in collaborazione con la dottoressa Anna Rotundo. L'iniziativa nasce con l'obiettivo di trasformare il teatro in uno strumento capace di rendere accessibili e coinvolgenti i contenuti di ricerca del dottor Costa. Oltre agli spettacoli dal vivo, Scienze Sociali in scena produce anche un docufilm e un podcast omonimo, ampliando la diffusione della ricerca attraverso linguaggi e canali contemporanei. Ed oggi, sotto la direzione del dottor Davide Costa, verrà presentato in anteprima il docufilm tratto dal suo recente saggio Beyond the Binary.
Solitamente questi tipi di eventi targati Scienze Sociali in scena, ovvero lo faremo con lo stile del docufilm, ovvero abbiamo fatto delle riprese insieme anche ad Anna Rotundo, che mi ha dato una mano in ciò, durante le ricerche, durante uno studio qualitativo sulle persone appunto transgenere di genere diverso. Questo ha portato alla pubblicazione di diversi prodotti scientifici, tra cui alcuni articoli e anche il recente saggio. Pertanto questo docufilm non è soltanto un invito a guardare, ma anche ad ascoltare le esperienze di vita, il vissuto incarnato, che i soggetti che abbiamo incluso vi racconteranno. Buona visione.
Come sei successo senza domande, no? La mia prima forgiata nel silenzio, rossa nei momenti bui e poi ricostruita. Con pazienza, lacrime, con preghiere, sussurrate quando nessuno mi guardava. Una fede che ha vacillato mille volte, cosa che
I studied several disciplines, but I never studied medicine. So I understand that I'm, in a sense, in an unknown territory here, at least unknown to me. So my intent in this context, in your context, which is a very special context.
Is a qualitative research method that has therapeutic power with respect to those who practice it and those who experience or have experienced particularly traumatic events. It is a bridge between the subjective inner world and the cultural context in which the social actor is embedded. In this paper I address the topic by treating ethnography as a social research method.
It studied how vascular diseases are socially pronounced, culturally interpreted, and institutionally managed. There are many challenges and considerations based on one thing, the role of multidisciplinarity. Thus, in conclusion, the emergence of vascular sociology marks the relation between different kinds of disciplines. Now, I conclude with this phrase. Let us listen not only the blood flow, but the voices within it. Thank you so much for your kind attention.
Patient's daily and night activity is able to test for a condition called sleep apnea, who is linked to a high burden of complications. applications, especially in the cardiovascular field, but not only. And in this brief example, I'll show you, we just tested this device in our patients. You see here, you can access the data from a mobile phone, but also there's also an online platform to leverage on artificial intelligence to improve
the regulation of these primary receptors, and I will explain what diseases are associated with these receptors. Then I will talk about the current drug molecule, dantrolene, which is a limited molecule. That's why we just try to enhance it, or we just try to discover novel molecules. Then I will explain what sort of modeling we are doing on this protein. In the end, I will show you what we did in terms of creating or discovering novel molecules.
Huge expectation from patients, older patients, new technologies. So how can we keep up to all of these? We are forced to ask, to respond to the question of our patients, to perform complex procedure in various patients with minimal invasive approach, limited precision, even more complex technologies to use. So the answer is innovation.
Che si propone ogni anno da 3 anni, con questa particolarità della sessione odierna, perché si ricorda di mio padre che è mancato lo scorso gennaio, dopo che purtroppo alla pranzo di Natale ha avuto un ictus sotto i miei occhi. Aveva avuto una polmonite da comunità asintomatica ed era in setticemia. Quindi si è smancato con l'ictus, poi ha avuto tutto un iter lungo e dopo un mese purtroppo ci ha lasciato. Dunque introduce mio padre poi un'emozione enorme ed è la prima volta che ci avviene ovviamente e ho poco da dire perché non conosco i contenuti del video, quindi posso solo ringraziare Davide e Raffaele, che sono tra i pochissimi che l'hanno ricordato in questa tenera, perché lui veniva qui con gli urologi, con il professor Lotti, Paniccia, dal cantone a fare lezioni di giornata e poi dopo seguo di lezioni si mette in macchina e vi tornano a Napoli e a volte anche lo accompagnavo, diciamo, non so, a Copanello o in altre spiagge mentre lui faceva lezioni d'estate. E quindi ho sempre avuto un forte legame con la Calabria e poi con tutta l'accademia che poi insieme ad altri ha contribuito a creare. Grazie ancora.
Come diceva Edoardo, ada passannutata e se si ha fiducia nella divina provvidenza, annutata passerà. Anche nel ricordare mentalmente gli avvenimenti della propria vita si è portati ad enfatizzare i lati positivi, sfumando i negativi, perché c'è nell'animo umano la tendenza a dimenticare ciò che non piace, ricordando ciò che ci rallegra. Tutto quanto è capitato nella mia vita mi lascia una sensazione di serenità. Ciò che dipendendo dalla mia volontà ho fatto, anche se talvolta errando, lo rifarei, perché ho sempre deciso le mie azioni in perfetta buona fede. Quando vado a dormire le sere, ho il piacere di addormentarmi subito, con animo sereno, perché non ho degli scrupoli di coscienza che mi impediscono di dormire.
Il terremoto in cui ha avuto veramente una grossa panico da Grazie, comunque.
Normalmente riservata soltanto a pazienti molto ben selezionati, cioè pazienti fragili, anziani, che hanno un'aspettativa di vita estremamente limitata. Altri approcci possibili sono tecniche ablative che si distinguono in forme.
Long procedural times and risk comparative organ distension. In fact, procedures like the thoracoabdominal or the aortoiliac extraction often require a close control of the arterial pressure, a stable dictal anesthesia, and a precise titration of diagnostic and opioid dosing. Generally, the traditional anesthesia is manual and intermittent, and the human-based titration of the hypnotic agent is associated with the variability over time due to the workflow.
Dear colleagues, thank you very much for your patience. Thank you very much for these two at the very beginning yesterday. I want that Dr. Costa, the other co-president, the other co-chair.
Thank you to those who will continue this dialogue beyond today. See you soon, and may your journey be a good one. Thank you.